Hello everyone, I am Dr. Namratha, consultant obstetrician and gynecologist at Lakshmi Multi-Speciality Hospital, Sunkadakatte. Today I will be talking about basic investigations which are done during normal pregnancy. Pregnancy is divided into three trimesters: first trimester, second trimester and third trimester. So what is this first trimester? It is the first 3 months. It is up to 12 weeks. Then second trimester is from 13 weeks to 28 weeks, that is next 3 months. And then third trimester is from 29 weeks to 40 weeks, that is last 3 months. So what are the investigations which are done during each trimester we will discuss. So as soon as a patient misses her periods, the first thing which we do is urine pregnancy test. If 2 lines are visible, she is pregnant. Sometimes this UPT gives false positive result. So the confirmatory test is by doing beta HCG or by doing scanning. So what is this scanning? It is usually done between 6 to 7 weeks. It is also known as dating scan. What is the importance of this dating scan? We'll come to know the is intrauterine or ectopic. Sometimes the pregnancy can be seen extrauterine. That can be seen in tube, ovary. Or we'll come to know the diagnosis, that is confirmation of pregnancy. We can calculate the estimated date of delivery if our cycles are irregular. We'll know whether it is singleton, twins or triplets. And then the basic investigations which are done during first trimester are CBC. So by CBC we'll know whether she is anemic or not. Then next is urine routine. So we can know whether she is having urinary tract infection or not. Then next is RBS, random blood sugar, or directly we can do 75 grams OGCT. So 75 grams OGCT is done if patient is a high risk, if she comes under high risk category, like previous history of big baby or previous history of gestational diabetes, or if she is a over diabetes or family history of diabetes is there. So directly we can do 75 grams OGCT. The next is serum TSH to know the thyroid levels. Next is HIV, HPCG, VDRL to know the syphilis infection or HCV. And then the last thing which we do is blood grouping. And then at the end of first trimester, that is between 11 to 13.5 weeks, we do a double marker along with scanning. This scanning is known as NT-NB scan. It is done to detect trisomies like 13, 18 and 21, that is Down syndrome. So when the patient enters second trimester, a detailed anomaly scan is done between 18 to 22 weeks. Like if there are any anomalies in the brain or in the kidney or in the GI tract or in the heart, medical termination can be done. So this scan is done between 18 to 22 weeks. If a patient is a high risk patient, like previous history of big baby, or if she is over diabetes or gestational diabetes, or if she is a heart patient, a fetal echo can be done at 24 weeks. And then between 24 to 28 weeks, again a 75 grams OGCT can be done. If the first visit OGCT is normal, then again at 24 to 28 weeks, a 75 grams OGCT is done. How this 75 gram OGCT is done? Irrespective of the fasting status, when a patient comes, when we give 75 grams glucose, after 2 hours a blood sample is taken. If a value is more than 140, then she is termed as gestational diabetes. Then if she is diagnosed as diabetes, then frequently her sugar levels has to be checked. And then a CBC and urine routine is checked again in the second trimester, because a pregnant lady is more prone for urinary tract infection. She can have asymptomatic bacteriuria. Then when she enters third trimester, after 28 weeks, between 28 to 34 weeks, an interval growth scan is done to look for growth of the baby, amniotic fluid, placenta, and then if she is a high risk case, we can do fetal Doppler. Then if a OGCT is normal in the first trimester and in second trimester, again between 32 to 34 weeks, a 75 gram OGCT has to be done. Why so frequently we have to do OGCT? Because Indian population is more prone on more risk for diabetes mellitus. Then when she enters her term, that is after 37 weeks, a term scan has to be done to look for the growth of the baby, estimated fetal weight, and amount of Leica, biophysical profile has to be done, and then fetal Doppler can be done. Before delivery, a CBC, urine routine, HIV, HPCG and VDR CRL can be repeated if it is done more than 6 months. Then how frequently a patient has to come for regular checkup? For the first 28 weeks, every monthly once patient has to come for regular checkup. After 28 weeks till 36 weeks, every 15 days once she has to come for checkup. After 37 weeks, weekly once she has to come for regular checkup. So these are the routine blood investigations and scanning which has to be done in her normal 9 months of pregnancy. Thank you.